Hi, let's talk about nocturnal enuresis, which is also called as bedwetting in our common language. Bedwetting is a common condition, especially in kids, and it's nothing to be embarrassed about. The main symptom is peeing during sleep at an age when the child is expected to be dry. Normally, children get their daytime urinary control by the age of 5 years, and some people may have their night control by the age of around 5 to 7 years. And if it is delayed than that, then it amounts to further evaluation. So there are two scenarios. One in which the child has not remained dry during night for at least 6 months continuously. Another scenario is when the child has remained dry, however he starts wetting his bed again, and the reason for this may be some recent stress or any other medical condition. So bedwetting as a symptom may have various causes like urinary tract infection, or the child may have a small bladder capacity. He may even have a deep sleep, or there can be some other medical neurological reason. Here I want to say that bedwetting is actually not a disease. We can say it is a delayed developmental reflex formation. So that means there's normally a reflex where brain senses the fullness of the bladder and it awakes the person to go to the washroom. But here that reflex is not developed as such in children by this age. So regarding the treatment, the good thing is that the bedwetting gets controlled by itself in most of the children in over a particular time. However, there are some lifestyle changes or some treatments we can do to hasten up the process. So I divide usually the treatment in three phases. First is lifestyle changes. There has to be decreased water intake, liquid intake in the late evening. Number two, reduce the intake of things which are bladder irritants, like avoid taking caffeinated drinks or a lot of things which have a lot of sugars in it. Third thing is bladder training. This means that we need to train the child to pass urine during the daytime at regular intervals, not to hold urine for a long time. And also in the night, we have to practice double voiding. So double voiding means that at the time of nighttime routine, let the child go to washroom once, empty his bladder, and then just before sleeping, we get him again to empty his bladder. So this is called a double voiding. And number four is use of bedwetting alarms. So these are specialized alarms which are attached to the undergarments of the child. So they go off immediately when they sense even few drops of urine. So once the alarm sets off, the child gets awakened and he goes to the washroom. So by doing this, what we are doing, we are setting up that reflex which I talked about earlier. And lastly, if these things are not working or in tandem, a urologist may prescribe some medicines which also help in getting overcome with this bedwetting problem. The most important thing I would say now here is that bedwetting is not a child's fault. So I always tell the parents that not to punish or sham the child for this problem, for this bedwetting episode. So what is required is that the doctor, urologist, the parents and the child, they need to work together. They need to be supportive and finally leading to a better confidence level in the child. Thank you.